Facebook page. So we're recording now. So thank you very much. And this session in particular is about the specialist assessment process, since our understanding has somewhat improved based on the experience of our own application, plus the people who have shared their outcomes of comparability, like partially comparable, substantially comparable, or even non-comparable. So I think from that point of view, everybody would want to know, like, what are the issues which leads to non-comparable outcome or partial versus substantial comparability outcome? What's the job market like? And what are the various situations related to specific specialties in terms of specific requirement? So let's start off with some crucial numbers. This is the clipping from the recent um, doctors GP magazines, that there is a huge influx of migrant doctors, and they're quoting the figures of about 4,699 doctors from overseas have registered to practice in the first 10 months of this financial year, almost double the number of previous financial years. So there are large number of doctors who are coming in, obviously, and that creates a sort of a competitive environment. The circumstances, however, for GPs and specialists continue to be good in terms of their comparability assessment. So I'm going to touch base on standard pathways for specialists. That means that you apply for your specialist assessment without the job offer. Area of need, that you have to have a job offer and then apply for specialist assessment. And short-term training, in which you have to have a job offer in a junior role, and then you also apply from a shorter version of a specialist assessment. Um, Moving on, this is just a quick graph in terms of percentages of various colleges, and overall, very reassuring numbers. So this is the abbreviations along that: Australian College of Dermatology, Australian College of Emergency Medicine, Rural and Remote Medicine, ANSCA is anesthesia, CICM is intensive care, and then we've got RACGP, which we get a lot of application, RACP, which we get a lot of application, that is physicians, and RACS is surgeon, RANSCO is ophthalmology, RANSCOG is obstetrics and gynae, psychiatry college, radiology college, we get a lot of, and this is a college of pathology. So substantially comparable, these are percentage number. So you can see that most of the people in dermatology college, 80% of them are partially comparable, only 13% non-comparable. Australian College of Emergency Medicine, we've had lots of application, and even from the same country, like I've dealt with quite a few doctors from Pakistan with FCPS. Some of them were found substantially comparable, and some of them were found partially comparable. So there's huge, you know, um, discrepancy as to the same degree would land you a different results. But overall, very reassuring results. Only 3% found non-comparable. Then we've got, ACRM. We won't worry about that. That's a GP pathway and RSC GP. But if you look at the total numbers, partially comparable 45, substantially comparable 55. ANSCA, substantially comparable 36, partially comparable 47%, non-comparable 17%. Then you look at the surgeons, like main 34, 34, substantially and partial, and 32 found non-comparable. So huge number. So this is the line which I'd like you to focus on. The non-comparability rate are highest for RACS and RENSCO, that is ophthalmology. RENSCOG is probably half, but normally people are getting good comparability outcome. Um, Radiology, 94% have been found partially comparable. Nobody has been found substantially comparable. And, 6% were found non-comparable. So overall, if you look at these numbers do look reassuring from the application point of view. Obviously, these applications, whoever you're seeing in substantiable list, are the people from the UK or US or New Zealand. They are the ones mostly who get the substantial comparability outcome. But as I said, we've had doctors from India, MD, and FCPS, Pakistan, medicine, emergency medicine, who have been found substantially comparable. In fact, one of our recent application for gastroenterologist MD from India was found substantially comparable even without the interview. I've never come across, and all of our application never had this kind of interaction with the doctor before. So overall, the numbers are positive from the comparability outcomes. Now, these are the number of doctors who have been offered a job state to state. So that is from July 2022 to April 2024. And if you look at these numbers, New South Wales, 1,800, almost 1,900. Queensland 1700, almost 1800. Victoria, 2233 doctors, and Western Australia 1500. Despite being one of the least populous state, I think, amongst New South Wales and Victoria, it has got the highest number of jobs, and I think predominantly these are the GPs going on there. So overall, the total number of doctors from overseas who've got job in between 2022 and 2024 are 8,910. These are the numbers which are available on APRA. And I think significant portion of these doctors are the ones who have come in through the GP pathway, the junior doctor and specialist pathway as well. So let's talk quickly about the eligibility, because there seems to be a lot of confusion around there. People often tend to confuse the eligibility that, look, if I've done 3 years of MD training or 4 years of FCPS training, and then I've got like at least 2 or 3 years of experience as a consultant, I'm good to go. Our experience is telling us otherwise. That is not the true case. And I think those graphs that I've shared with you, these are percentage number. So if you equate the non-comparability numbers with actual binary numbers, those who have been found non-comparable will be much, much higher. So um, one of the things is that your degree, whether it's DNB or MD or MS or FCPS, must obviously be the highest specialist degree in your country of origin. Pakistan, Bangladesh, India. We get a lot of doctors now getting from Bangladesh. So that's very reassuring that their FCPS has also been considered. There's no such thing as the degree being recognized. Australia is not in a business of recognizing your postgraduate qualification. They only compare. So that's why this process is called comparability assessment. How well your postgraduate qualification compares to that of an Australian trained specialist. Now, it could be partially comparable and substantially comparable. That's the first concept you must have to have, that you have to have a highest special degree of country of origin and be on a specialist register. And plus, this is a comparability assessment process. The other thing which we found recently, the college RANSCOG picking up on some of our applications, is that, your degree as an MD or FCPS should be regularly reviewed by the authorizing body. So it might be your local state licensing authority. For Pakistanis, it might be Pakistan Medical and Dental Council. So there's someone who's sitting above the College of Physician Surgeons of Pakistan, who is checking up on them and making sure that the program of training is regularly scrutinized. You may remember that, there might be committee visiting your hospital every few years to make sure that the training program is good. Here in Australia, it happens exactly the same thing, that our hospitals get reviewed by the College of Emergency Medicine Committee, who look at the training program, who look at the numbers of trainees, who look at the number of tutors, who look at the number of supervisor, and they make sure that the balance is right. They make sure that the program that is delivered is in accordance with the licensing authorities for specialists. And that happens frequently, every 5 years. So make sure that there's some documentation to that effect, because some of the colleges are actually nitpicking on that. Um, Competitive entrance. So yes, most of you who would have entered the specialist training would have passed the FCPS Part 1 or NEET PG exam or postgraduate entrance training exam. Doesn't really matter. But I think those kind of exams are important to highlight, that we just did not walk into a specialist training. It was some sort of a specialist assessment process. Now, curriculum is the other thing. Now, I have realized that there's a huge emphasis being placed, especially by the RACs, which is Royal Australian College of Surgeons, RANSCOG, which is obstetrics and gynecology, and even, if you've got radiology, if you can find the curriculum, the training that you've done in your own country, the specialist training, it has to have gone through some sort of format or structure or organization. There will be a document, trust me. There is a document. It's just that we never seen that document. But the colleges over here are asking you to produce that document. If you don't produce that document, then the whole application is built on, your word. And there is nothing to back up your word in terms of experience, that, look, I did this first year as a general training in various specialties. Second year was more specific to my specialty. But there's got to be a structure in that. So there might be a structured curriculum in your hospital or medical college where you're getting training, or the CPSP, or College of Physician Surgeons of Pakistan, they may have a structured curriculum. So try get that curriculum and attach that with your application. Duration of training. Now that's where the main contention is. Almost all of Australian training programs are 5 years, no exception. In fact, it takes more than 5 years for the specialist to be, made here in Australia. But the actual training duration, 5 years. So when they are assessing your application and your training program for FCPS is 4 years and MD and MS is only 3 years, then there is a dilemma. What do we do about the missing years? So then what we have done with our previous application, we've used the SR years for Indians. So if you've done an SR ship of 1 year or 2 year, plus on top of that, if you've got consultant years, so 2 years of SR experience and 3 years of consultant experience, then it looks good. You can say that SR years were still under supervision training. And then I've got on top of that consultant experience within the full scope of practice, which I'll explain to you what it means. So duration of training is important. Same goes with the FCPS. You may have completed your training program in 4 years, but if you've done a post-fellowship experience for additional year. Now, I was just doing a consultation with the radiologist about half an hour ago. And after the completion of FCPS in radiology in Pakistan, he did a senior fellowship year in the same hospital. So then that adds much, much more credibility. The colleges here have got no problem if you work in the same hospital after finishing your training program, after your part 2 exam of MD or FCPS, but you have added 12 more months of training. So that's very important. Then specific components of training. So this is one of the other reasons with the applications getting rejection. So as there was a pediatrician from Bangladesh who was asking about, look, I've got this 5 years of experience and I'm also working as a consultant. Fine, it is a very good start only. We need to go into the specific, especially in pediatrics. The main rejection issues are lack of community and behavioral pediatrics. Now, when I say these words, people who've got pediatric training back home in Pakistan or India or Bangladesh, they lose their mind. Like, what are you talking about? Community and behavioral pediatrics, lack of developmental pediatrics, okay, lack of adolescence pediatrics, child protection modules or training. So these are the part of training structure here. And for some naive reason, Royal Australian College of Physicians, which also assesses the pediatric applications, expects the people back from Pakistan, India, Bangladesh, and wherever they're coming from to have done these community and behavioral pediatrics, developmental pediatrics, NICU, pediatric emergency medicine, and child protection modules. Now, are they a deal breaker? Yes, they are. If you don't have this experience, your application will not go ahead, despite the fact that you may have 4 years of experience or 5 years of experience or even 10 years of consultant experience after that. They will just nitpick on these four issues and they will find you non-comparable. The other issue is that you may ask that, look, when I come to Australia after even a specialist comparability assessment, I'm no longer working as I'm not given a job directly as a specialist. That's true. I will be working as a registrar. Can I not compensate in that registrar year the deficiencies in my curriculum? Yes. Yes, technically, absolutely, you're 100% right. You can. But for RSCP, it's only 12 months. They would not give you any more top-up training time more than 12 months. So if you talk about those specific of community and behavioral pediatrics, developmental pediatrics, and child protection modules, if they all need to be squeezed in, by the way, all of these jobs are 6 months each. So if you need to squeeze in, like say community and developmental pediatrics, 6 months. Okay, behavioral pediatrics and adolescence pediatrics, 6 months. That's 12 months already. What about the child protection module? What about your emergency experience is not adding up? They will not go beyond 12 months and they will find you non-comparable. That's what's happened and that's what people have shared with me. Plus, it is also about the component of training. So in Australia, there are 3 years of basic pediatric training and further 3 years of advanced pediatric training. Back home, where we come from, it is just 4 years of program or 3 years of program. There's no clear distinction as basic and advanced. So it goes on showing how much specific we need to be in the application form to distinguish the components of training, to align. As I said, it's a comparability assessment process. We need to align those comparisons throughout the application form. And lately, with increased number of rejections, that's what we've come to realize, that if you don't align yourself to the curriculum, it's not going to happen. Exams, most of the MD exams and FCP exams are good. These are the least of your problems. If you completed your exams and if they're articulated well in the application form, normally it's not a big deal. It's the training components. Logbook are another big issue. So logbook, there are set training requirements. There are set logbook procedures which need to be clocked in. They need to be both in your basic training, advanced training, and also a separate logbook for consultant experience, and all needs to be signed. So these are various documents. And CPD requirements. There are CPD requirements of 50 hours of CPD per year. Now, again, CPD is something which people are not used to back from India, Pakistan, and Bangladesh. But then again, it's not a major deal breaker. We normally work around a structure in terms of if you've done any teaching presentation, if you've attended any conferences, if you've attended any workshops. And plus, we also give you some special links at the start of your application process that, look, these are online training CPD modules. You can easily do them and add up those hours in your application. And they're not even expensive. Like, I think one of them goes on for $150 for 12 months. And that could easily accumulate or start accumulating the number of hours by the time you're ready to lodge your application. And then when you put it in addition to your already local experience, CPD looks okay. All right, next up, we have got, okay, why is it not going ahead? Okay, no, that's it. Now, okay, documents what you require: MBBS, internship certificate, specialist medical qualification, specialist registration license in your own country. Obviously, you need to be on a specialist license. Name change, curriculum, as I've highlighted in the previous set. Logbook, we've talked about. CPD evidence, we've talked about. And completed application form, perfectly aligned with that of the curriculum. Some of the colleges like RACS ask for the college of letters of support from your previous job, so that might need to be produced as well. And they're not very detailed letter of supports, just to confirm that, look, Dr. XYZ was working in this hospital under this role from this duration to that duration. That's about it, really. English language requirements. Now, by the time you're lodging your application, for most colleges, apart from a general practitioner college, you must have passed your English test. That's one of the basic and fundamental requirements. So IELTS is okay, OET is okay, PT is okay, even TOEFL is okay. Now, application. I would say read the curriculum of an Australian trainee. That is very important. Um, as I said, the training over here for all the colleges is divided into basic training and advanced training. Make sure that your MD and FCPS training closely aligns with that basic and advanced training components. Now, it will take you a lot of time because these trainee handbooks are 200-page documents, and I'll show you some of them. And the handbooks are really like a roadmap to your specialist applications. That's why this application in itself takes months to fill in. It's not, if you are just filling in the form, it may take you 20 minutes to do that. But if you're not, as I said, comparing yourself, if you're not aligning those experiences, that's good as rubbish. So you need to read and understand what the training structure is like in Australia for your specialty. And when you're filling in that form, when you're aligning your roles, you're aligning it with some evidence and some scientific knowledge. That's again matching the training components. How much of it is basic? How much of it is advanced? Matching the exam components, part one, part two. What do you do in each of those different parts? Matching the logbook procedures. Lately, I've seen lots of college nitpicking on the individual logbook problems. That, look, you've not done, especially for gynae obs, they are fixated for these laparoscopic procedures, that you have to have a laparoscopic. Now, most people coming from, subcontinent, they don't have laparoscopic exposure as much, but they want laparoscopic to be put in, at least some sort of exposure. So if you have not got any laparoscopic procedures or understanding, then the application would, not go ahead. And then you'll say, oh, I was found non-comparable despite the fact I had 5 years of experience and 6 years of consultant experience. Now, full scope of practice. This is a very important term, and you will see this term very commonly being used in the specialist assessment process. So the consultant is just not a clinical consultant. So some of you who are working as a consultant in a private hospital or in even tertiary public hospital, they would be working in a clinical capacity. But if you compare that to the role of a consultant who's working in Australia, in an ideal world, they would have clinical role, they will have non-clinical role, they also will have some administrative role. So make sure that your role is spread across all of these areas. You've got administrative responsibilities. Now, there might be some research that you're involved in. There might be some governance of the department that you're working in terms of rostering or staffing or some risk management or complaint handling. That is also good. You might be involved in some formal education and teaching of the junior trainees on a formal method. So that's very important. Then clinically, obviously, your scope of practice need to be fully representative of an inpatient, outpatient, operation theater if it's a surgical specialty, and ward rounds and emergency coverage as well. Full scope of practice. So lots of people have contacted me that, oh, look, I'm working in this very super specialty clinic type in Saudi Arabia, but they're not patients which we admit under our care. So that means it's not full scope of practice. Your application is not going to go through. So we had someone like this just recently registered, and I had to refund them the amount. I said, look, it's very unlikely you'll go and your application would be supported. Then CPD activities we've talked about. Publication, audit, and governance are important. And you would have all done at least one research, either a dissertation or a topic that you research for. Audits are something which we tend to think about, oh, it's such a complicated process. It's not. Audits are just, your current practices, how closely do they align with a national standard or international standards? For example, if you pick up something is even as common like rates of um, adverse drug reactions to the patient under our care. Now, the national acceptable standard would be somewhere close to about 3%. And your unit may have adverse drug reactions close to about like 8%. And you said, okay, the reason that we are because not every doctors and nurses are checking that they've got any allergies and giving the medication before asking. So what we've done is we've, uh, you know, uh, created processes to make sure that the doctors check up the allergies, document the allergies, and the nurses ask the allergies before giving the medication. And we found that our rates of 8% have now reduced to that of an acceptable standard of national, which is about 3%. That's an audit. And you don't even have to publish an audit. It could have been presented in a meeting. So, this is something which really adds substance to your application, audits and governance. So make sure that you don't let it go by just because you have not done it and you don't understand the process. That's why I say it's a very conscious and informed decision to do. It's like a complete overhaul of your specialist training. Teaching and supervision is very important. So just simply saying that, look, I teach junior medical officer, I teach medical student, I teach nurses, it's not enough. You need to demonstrate some sort of more commitment that, look, I teach final year medical students. These are the phase 3, or, I specifically teach them about the clinical medicine, or I specifically look after the ops and gynae modules because that's what my area of specialties is. Or I teach them radiology stuff because that's what my area of specialties is. This teaching is roughly structured around 8 hours per month, with 2 hours being every week. So that adds a little bit more credibility. And then you confirm this by producing some sort of document from the university or a medical college that, yes, Dr. So and so is involved in the teaching of the final year medical students in this number of hours, and it's a 3-month cycle, and then he'll get new students. So everything which is explained well and it's documented, evidenced well, will carry marks. Structured references, people often say, oh, what do we write in structured references? Structured references, all you got to do is just provide the contact details. The college will send them out a link, which is an online link, and they have to fill in online report. And that's got to do with your, what role are you doing? How long have you been doing that role? Your communication skills, your, clinical competencies, and, everything that you do. You don't even get to see that structured reference. It's an online thing. These are the curriculum. So this is the handbook of anesthesia training. This is a radiology training curriculum. There's a general medicine. There's an Australian College of Emergency Medicine curriculum. There's general pediatrics, cardiology, Franz-Cog, or obs and gynae. So these are big documents. These are, at least I was looking and reading up the handbook of training of anesthesia and radiology. These are like almost 200 pages. But it serves you well if you read these documents, especially from the section of your training components or your exam component. It just makes the whole process crystal clear. This is the general pediatrics and all of those requirements which I was saying in terms of behavioral pediatrics and community pediatrics and developmental pediatrics all in there. Then there's an interview assessment process. So interview, most of the interview comes from the application form. You need to have read your application form, straight up. So make sure that your application form is well written and you completely verbosed and memorize the entire application form. Um, when you present the information to the panel, and mind you, this interview goes on for 45 minutes to about 50 minutes, that's where actually judging you, whether you stand a chance of comparability outcome or not. If you are just presenting yourself as a medical student, you've got no formal training in terms of an interview, they may not say anything. They will, in fact, not say anything, but it will just not look good. You should have a very good, calm, and consultoid approach. There's a word called consultoid. When I was doing a fellowship exam in emergency medicine, consultoid approach. So very organized structure. That look, I'm working in this hospital. It's a large tertiary level teaching hospital, and our department is one of the departments which are at the forefronts of recent developmental advances in field of radiology. We've got this many resources in terms of staffing, that many machines, and our rosters is quite robust from both emergency and elective procedures point of view, which makes it whole experience of practicing as a consultant or senior fellow worthwhile, professionally building up my career. So it just sounds like, okay, fine, what you're doing makes perfect sense. Um, Organize when you're giving your exam components. You don't have to say, okay, for part one I did in 2014, part one has got this component and this component, this component. You just have to be very articulate about it. Look, our exams are organized in a theoretical component and a clinical component. Theoretical component mainly test our basic clinical sciences knowledge and assesses through a combination of various assessment tools, which includes multiple choice questions, some viva questions, and some slides and pathology specimen. This is the duration. It is conducted in the presence of both, local examiners as well as national, as well as some international examiner, so as to ensure the transparency of the exam. Now, moving on, the fellowship or the final exit exam is composed also of theoretical and clinical components, mainly on the same line, but bit more in depth to the area of your specialty. Also, there's other assessment modules. Like there's a lot of reliance in Australian medical colleges on tools like case-based discussions, shift reports, in-training assessments. Now, I know back home these tools are not formally utilized, but I know that every morning we are doing that. We're doing academic ward round, presenting cases. The consultant is grilling us like, what are your differentials? How would you examine the patient? What investigations would you do? And what investigation would give you what outcome? So our ward rounds were actually the best way of learning this. Plus, our patient volume is much, much more than in Australia. So I believe in my mind that our experiences or the experience of a consultant who've trained back home are much more robust and in-depth. But when it comes to transferring those information on a piece of paper, that's where the real task and the challenge is. Now we've talked about, duration is only 3 years for most Indian consultants and 4 years for Pakistani consultants or Bangladeshi consultants, but they need to be compensated. There is no way any college will accept that your training is less than 5 years. So if your training is only 3 years and plus you're directly working as a consultant, well, good luck. It will be very tough. It will be, a lot of engineering that has to go on and show that, look, you've got MD in general medicine, and then for 5 years you're working as a consultant immediately after that. So now, for RSCP or College of Physician, there is a rule, there is a clause that some of your consultant experience can mitigate the deficiencies in training. So if your training is 3 years instead of 5 years, your consultant experience can be used or utilized to compensate. But then again, your consultant experience, again, as I said, the word full scope of practice. It can't be just, working in a private hospital and I've, seen, oh, I'm working in this super specialty hospital. So what you're doing in super specialty, well, not much. I'm just seeing patients. That's not full scope of practice. So even though that these are big hospitals, I think we fail to describe how well of a job we are doing. So that's again very important. So we need to compensate. We need to spend time as a senior resident or a fellow after the completion of training program. And I'm pretty sure that if you worked as a junior consultant, even we can modify that into a senior supervise role to make up for that deficiency, because that's what we've done with good outcome. Consultant experience, as I said, full scope of practice, clinical, non-clinical. Match logbook procedure. Logbook are very important, and there's certain specialties in which logbooks are absolutely detrimental. And it's just not the process of creating a logbook. Logbook needs to match the procedural section on the application form, needs to match the interview when they're asking questions specific to your elective, emergency, and outpatient procedure. It's all needs to be transparent, equal. All right. So just make sure that your logbook is done well. And most of the colleges, College of Dermatology, I recently had an interview with the College of Gynecology, 6 clinical scenario they asked you. And there's a way of approaching the clinical scenario. Remember, it's a consultant level interview, you're no longer a medical student. So you need to have a complete command that, look, this is a patient who's critically unwell. These are my priorities. These are my resources. This is what I would take a leadership role in terms of assessing first quickly, at the same time resuscitating the patient, and ensuring that these pathologies are dealt with in a much more robust way, with a clinical prioritization and delegation, and with these set of specific things which need attending. So, you know, solving a clinical scenario as a medical student or a junior doctor is a different thing, but solving a clinical scenario as a consultant is a completely different thing. And that's what they're looking for, that your reliance on these terms, and plus doing a debrief, using this challenging case as an educational opportunity. There's so much which is going on which you can add on. And they may invite you to talk a little bit about your publications. So if you've got 4 publications, this is very good. They may say, look, we've seen the publications, you've done a study on a series of pancreatitis. Can you just take it through what led to? So you can say, oh yes, we were getting a lot of pancreatitis cases at a certain time, and we found that despite the most common causes of pancreatitis are alcoholism, gallstones, but in our part, with that particular time, it was a viral infection, because that was largely driven, something like that. I'm just giving you an example. So talk through your publication. What were your primary intentions of doing that research? What were your primary outcomes? Did you publish or present that research? Just to sound more in command that whatever you've done is a genuine thing. And overall, having a consult-wide approach. It needs to be very calm, very collective, very verbose in terms of you telling your skills and experience. Non-comparable outcomes, duration of less than 5 years. There's no exception to that rule. Your interviews are just not making any sense. They are just random. They're not linking up what you've put in application form or logbooks or support letters from the consultant. It's just suboptimal. Your consultant experience is in not within the full scope of practice. You're just doing a clinical work. There's not much non-clinical work. Or recently we've seen some rejections in which the consultant experience for general medicine people were more diluted by having a neurology experience or having a cardiology experience or ICU experience. That is more prevalent for the doctors coming from India, that even though you are working as a respiratory specialist or a general medicine specialist, there's a significant amount of information coming that, oh, I'm doing I'm doing ICU ward rounds. Like, no, please don't mention that. ICU ward rounds are not required for your consultant level experience. You need to stick to general medicine. If you're pediatric, stick to pediatrics. There's no ICU is a separate specialty in Australia. Okay, if you're doing procedures as a consultant like intubation, being a pediatrician, that's not required. You need to do consultant procedures as a pediatrician. You need to do consultant procedures as a general medical specialist. So just be very careful. And that's why I said that, look, it's very important to read the curriculum. Components of the training is not matched. Deficiencies cannot be met in that supervised training duration. For mostly, it's 1 year. I think for College of Surgeons, it's 2 years. And radiology is 2 years. But you've got to understand that, look, the more years of top-up training time that you add up, or they're granted to you, the difficult it gets to get a job here in Australia, especially for those niche specialties. And you'd be stuck. And the outcome report is only for 2 years. And if you're not able to find a job in 2 years, that what's the process or what's the point of doing the whole specialist assessment? I mean, the future is looking great. You've just found partial comparable. There's no further exams, especially from the physician's point of view. But if you're not able to find a job as an anesthetist or as a radiologist or as a surgeon, then what good is that outcome? Okay. Insufficient logbooks. As I said, people don't pay much attention. Recently, one of the doctors registered with us, and she said to me, "I've lost my logbooks." And I said, "Well, I mean, there's nothing much I can do about it." And we tried to create some different ways to have that logbook reproduced or retrieved. But if there's no logbook, I'm sorry, if the specialty requires you to produce a logbook, that's an essential document. We can't do much about it. Expedited pathways, I think there was a question. So currently, this is only open for GPs from the UK, Ireland, and New Zealand. Specialist pathways are starting or meant to be starting in December. I think initially they're taking psychiatry, obs and gynae, and radiology. Look, not much is available in terms of who would be found comparable for expedited pathway. But given the fact that the GPs from UK, Ireland, and New Zealand were only accepted for specialist pathways or expedited specialist pathways, I think specialist hospital pathways are going to also be from these countries, UK, Ireland, New Zealand. Don't quote me for that if that's not the case. But that's what my overwhelming feeling is, that the specialists from the UK who have completed the UK CCT training, not just MRCOG, MRCS, or FRCS, or those kind of exam, but they have completed the complete training program in the UK. They've passed the UK exam. They're living in the UK. They've got a full registration in addition to completing the training. Same goes for Ireland. Same goes for New Zealand. If you've done that, then you can apply for expedite. And for these doctors, the pathway has been expedited because you no longer are applying to the college. You're applying directly to APRA. They ask you to apply for directly a consultant level position with only 6 months of supervision. So that's a big thing for the people who are coming from the UK and Ireland. And hopefully down the line, more pathways are incorporated in that. But at this stage, it looks like it's pretty much these three countries only. Well, let's see what happens in December. Now, job chances. There are good job chances for emergency medicine. The specialist application forms that we've done for emergency medicine, pretty much all of them were able to find a job within a month. General practice, no need of saying that they even get a job offer before the comparability outcomes. General medicine is going good. It takes a bit of time. You have to understand that it's a lengthy process. Give yourself 6 to 8 months. I'll talk about what are the specific which are needed to increase your chances a bit later as well. Pediatrics still good. Radiology is very good. Psychiatry is exceptionally good, and challenging surgery. So people who have general surgery, orthopedics, dermatology, ONG can become a little bit of challenge. However, there are plenty of jobs out there. It's just super competitive because they're given the large number of jobs, there's equally large number of candidates. So that's why I've put in a challenging list. Orthopedics, ophthalmology, ENT, respiratory medicine, cardiology, and gastroenterology. So all these procedural specialties, they get a bit challenging. So how can we ensure that you get into? So I've included like this thing that these are the specialty which are challenging, and what can you? So make sure if you are belonging to any of these specialties, you've got good level of tertiary hospital experience. Your training is at least 5 years, plus you've got at least 2 years of consultant level experience. Um, Full scope of practice, inpatient, outpatient, clinical governance, quality improvement, teaching, publications. You've got good procedural hand in terms of elective and emergency cases. I also say that, look, if you're belonging to all of these specialties, perhaps better to apply for a fellow jobs first, rather than wasting all your money and resources and time in specialist application. Apply for a fellow job. And all that it takes is to have an EPIC and AMC portal and English test, and then apply for fellow jobs. It does not cost you anything. Obviously, you need to have a CV very well done, because people often don't think that, look, I've seen some appalling CVs. Um, and based on those CVs from specialists, I don't think that they would even qualify for an intern role. So if you've got a good identified that, look, I'm working as a laparoscopic surgeon and I would like to gain some more additional experience as a fellow in laparoscopy for minimally invasive sort of hernial repairs, or, gynecological procedures from laparoscopy point of view, there are plenty of fellowships. Now, there are certain areas where the fellowships are not very prevalent, which are radiology and anesthesia. I don't see many fellowships. But gynae fellowships are there, surgical fellowships are there, orthopedic fellowships are there. We've recently helped short-term training pathway for orthopedics as well. Radiology, they've gone on through directly specialist communication. Also, make sure that you've got publications. If you're just sitting idle, try get some publications then. Administration, clinical governance, we've talked about. And if you have got, Middle East experience or UK experience of 1 to 2 years, then again, you've got a very good chance of uh, getting a job, not for the comparability, because the comparability of specialist is only for your training that you've done, but it improves your job chances. Now, CV and applications are paramount. It's like, if you've got all those credentials, but if your CV is looking poor, photographs, 3 columns, very busy, not really highlighting, not your CV should be like first page, wow, that kind of feeling. And if it's not really doing that, it's in this current environment, I don't believe a lot in CVs, to be honest. But I do believe that um, till the better way of assessment is available, the CVs are still relied for shortlisting for these very competitive positions. Finally, I think if you're found non-comparable, you can do AMC Part 1. You can get further 12 months of Australian experience and then join the training program. It's not bad. Like, I mean, if you do that, then you can apply for recognition of prior learning. And all of the colleges, if you've completed MD or MS or FCPS back in your own country, you will get prior training experience counted towards the advanced training. So it varies from application to application, but I think I've seen people getting at least 12 months knocked off based on their 3 years worth of experience. And even if that like 12 months get knocked off over a 5 year, it's the program condenses to 4 years. So it's a better than any given circumstances. What about AMC 1? So we had a gynecologist who said that she's done AMC 1 and she's an ONG specialist. If you're wanting to come into Australia on an urgent basis, then yes, you can apply for pretty much any job. Remember, it's a pyramid. Most jobs are junior doctor, then middle grade, less jobs, and top specialists or fellow jobs are only in tens and twenties. So AMC 1 does help you, does get you come across more polished because you'll have a lot more clinical experience. You've completed a specialist exam. So we've seen some of the people who've done AMC 1 and have got a specialist level qualification in good specialties, emergency general medicine. Within a month, they're able to get a job. So this is just a quick snapshot in terms of various training durations and um, remember, it's mostly 5 years plus for all those training. But just because there's certain other intricacies, like for College of Anesthesia, there's a fellowship requirement. For College of Surgeons, there's also uh, a non-accredited training requirement plus a fellow requirement. So that pushes the duration up to 7+ years. For GP is only 3 years. For ASM, it's 5 years. Exams, we've talked about. Consultant experience ideally should be 2 years plus for most specialties. And then logbook requirement are for obviously there are certain specialties. For physicians, if you look at the form, there's an asterisk with certain procedural specialties like gastroenterology, cardiology, pediatrics, neonatology. They need to have a logbooks. And RANSCAR don't have a logbook. I think interventional radiology, if you're doing, you may have to have a logbook. Anesthesia may also want you to have a logbook of some sort. RANSCOG, yes, definitely. There's a logbook template. So if you got that logbook template, then that helps. And yeah, these are the requirements. So timelines, most of the colleges take about um, 3 to 4 months, but College of Surgeons takes about 12 months, and College of Dermatology close to about 18 months to get you the final outcome. So this is my drill. Overall, I hope it makes sense to all of you. I will just pause the video here and stop the sharing. And based on this improved level of understanding or some level of understanding, I'll just go through the chat box questions, see if you've got any questions. Gastroenterologists, I think there is a scope for me. So first question, Dr. Prolaw, I'm interested in specialist pathway as a gastroenterologist. Do you think there is a scope for me and there is a assuring supply of jobs? Is it feasible to find jobs together with a spouse? So three questions, I think, in a single question. If you're interested, look again, gastroenterologist, competitive specialties, 5 year plus training, at least 1 year of fellow, plus 2 years of consultant experience. Yes, then why not? Um, Feasible to find a job together with a spouse. First job is not to be compromised in any way, depending also what your spouse is specialty is. If she is gastroenterologist or some of the you they might be able to find a job within the same state, but look, first job can always be a bit more challenging. So I always advise that, look, wherever you get the first job in whatever get, just grab it, and the second and third job, it becomes easy. Sidra has asked, consultant anesthesia from Pakistan here. Please tell us about applying for specialist pathway. Do we need AMC? I think we've covered that question. Dr. Harshini, anesthesiologist, 3 years SR ship post MD experience. Very good. I'm interested in specialist pathway. Do I need NC exam? No, Dr. Harshini. If you've got 3 years of SR experience, post MD, then you've got a very good chance, provided the application form is done well. Job opportunities for anesthesia are still better. They're good. And how long the process will take from application till I get my results for an interview? About, I'd say about 16 weeks, 12 to 16 weeks. That's what most colleges. How to apply for jobs and what is that? How to apply for jobs and get one surely after passing MCY standard pathway, and what is the scope of getting into PG, and how much duration will it take to become a consultant in Australia? That's a very generic question from Dr. Jhanvi Goyal, that how to apply for jobs. We've got a job application portal. It's a big thing, and we need to have your CV and application and interview techniques, everything polished up. Once you do that, there are portals. We send you the jobs. You apply for the jobs. Once you get shortlisted, you prepare you for an interview, and then you apply for jobs. The duration, I've seen people getting a job within a month, and time people getting a job within a year. So it's quite random. It all depends upon how inquisitive and how much oomph have you got in your own petrol tank. Neurosurgeon, FCPS Spark, SRCS, 12 years post FCPS experience, mostly in Middle East, working as a consultant in middle grade. What are the chances of getting registration? Not as a neurosurgeon, you have to start again from the assessment process. Surgical specialties are one of those things which are highly competitive, especially as a neurosurgeon. There are only 2 or 3 positions for a neurosurgeon. That's the national climate for neurosurgeons. So I think it's going to be, first you've got to get a specialist comparability outcome, and then after the specialist comparability outcome, you have to apply for jobs. And the comparability outcome for the RACs is one of the stringent and strict one. Takes about 12 months, almost a year. So not to discourage you anyway, I think you're far better off to apply for fellowship position. And if you're just inquisitive, I think fellowship position might be a better way to go about it. Can you let us know if diploma in India 2 years is recognized specialist qualification, in Australia? No. FCPS in ophthalmology and MRCS ophthalmology glassing working as consultant 26 after 4 years FCPS in consultant. 4 years SCS student. What chances getting RAN score? RAN score is pretty tough. 4 years of FCPS might not cut it. But then again, I don't know the specific of your application and credentials. Probably bit of a chance. MRCGP International South Asia has no structured program allows candidate. All MRCGPs are going very well. If you've got 3 years of GP experience in MRCGP International Southeast Asia, you can apply for a PEP pathway. How many years of consulting experience recommended? 3 years, ideally 2 years would be fine, depending on how much of your fellowship experience is. Fellowship in urology. What about fellowship in urology? Competitive, hard. If you've got an experience, just make sure you've at least got 5 years of training and at least 2 years of SR ship and 2 years of consultant experience. As I said, for more specialty. For set format of CPD requirements, like any template, no, there's no template, but if you Google CPD requirements Australia, it will open up all the required recommendations. How does an IMG diagnostic radiology get substantially comparable? Because from what I know, most will get partially comparable at best. That's true. From RENSCAR, most of them do get partial comparability outcomes. There was one gastroenterologist who got substantially comparable from India. Also, emergency physician who get substantially comparable from Pakistan. In consolidated logbook formally signed by supervisor, detailed number of different procedures done on different levels of supervision sufficient. Yes, there is a template. You need to follow that template. You don't have to create your own logbook. It's a template you have to follow. Can I book one-on-one career guidance ASAP? It is whatever's available on website. I think our consultations are now going into February. We try to get more people to come and guide you, but you can book in a session. You have advised me to try for specialist pathway regarding have one top from your videos. I recognize for a chance of comparability, especially substantial comparability needs minimum 4 years of training and 2 years of experience as a consultant. No, 5 years of training and 2 years of experience as a consultant. I did my MD emergency medicine for 3 years and post MD complete 2 years of senior residency and presently in the third year of senior residency. But till now, I haven't heard work in resident consultant. I think you've got a good position. You've got a good chance. If you've done 3 years of MD in emergency medicine, plus you've got 2 years NSR, it is equivalent to almost 5 years worth of training. And you are continuing with the third year of senior residency. The specialist comparability application is the comparison of your training, not your consultant experience. Consultant experience is helpful to mitigate the deficiencies in your training. So if you have completed a good program, completed all the exams, and your SR is again in a good hospital, then mostly SSR in India, you're working sometimes as an assistant professor, and you've got good chance. I think we worked this with a number of other candidates, and you'll at least get a partial comparability. There is, I think, not a substantial comparability based on what you've told me, but definitely a partial comparability. How about the area of need short-term training, if not substantial? No, 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 no. Area of need, don't confuse it. Area of need, they're not desperate for you. Please be very clear in your mind. Area of need is a completely different kettle of fish. They are only looking for very, very experienced doctors. In fact, I don't even find area of need jobs when I'm looking for it. They want experienced doctors. These jobs are advertised by state, depending on where these jobs are. Mostly area of need jobs are for GPs. There are some specialists thrown in there as well. Most of the specialist pathways and doctors, there are some coming in radiology. So radiology, good chances area of need. GPs, excellent chances in area of need. Emergency medicine, good chances in area of need. But then again, these are the people who've got very good experience. In fact, better than most people who would be applying for specialist role, because you'd be working with less supervision. How about the area of need short term? Okay, okay, okay. Do we need to have a permanent PMDC license or provisional license with house job sufficient to doing AMC 1 and 2? Don't know about that. Maybe. Can you please highlight about the costing of application for interviews? Is it refundable? I don't think the college will refund you once you've started the process and you've been found comparable. Ali Hassan, you can yes book career guidance session, a one-on-one. Does fellowship in Australia help in improving specialist comparability application subsequently? Not really. No, no. When you've completed fellowship here, you'll be a consultant. How about area of niche short-term training in psychiatry? So psychiatry is different. Psychiatry, you have to have a job before you apply for a specialist comparability application. That is good in a way, but then bad in a way as well, because sometimes the hospital don't take you seriously because you haven't got a comparability outcome. But then you have to have a job before you apply for comparability outcome. And overall, they've got a good successful rate in terms of partial comparability. Can you share a video recording after the live stream? Will do, Dr. Mia. Or please make a video on standard pathway for specialists. Standard pathway for specialists. Well, there's not much to say about it. Just do AMC and start applying for junior doctor roles. I'm working as a consultant internal medicine 4 years, done FCPS internal medicine, MRCP UK. What are the chances of comparability? So if you've done 4 years of FCPS training and passed the FCPS in internal medicine, then we need to make sure that you align with the minimum comparability standard, which is 3 years of basic physician's training and 3 years of internal medicine, so 6 years. So if you've got 6 years of experience, including your consultant experience, then good. But if not, then that's not good. Now, MRCP UK does not count towards specialty assessment. What do you mean by fellow job? So fellow jobs are the jobs that any consultant from Pakistan, India, Bangladesh, or anywhere in the country Arab board can apply for. And these are the like fellowship in arthroscopy, fellowship in retinal or vitreal surgery, fellowship in emergency medicine in, academics or point of care ultrasound. These are very specific, sub-defined, sub-specialization, and these are short-term training. So without doing AMC, without doing any specialist application, you can come here, you can apply for these, you can apply for these jobs from back home in Pakistan and India. These are very competitive. That's why I say that you need to have a very good application and interview techniques for that. We recently helped one doctor in orthopedics, and he's been able to find a job in orthopedic fellowship from New Delhi. We help him from the CV, help him from the application, sent him job every week. Jawad, Mr. Jawad, who looks after this specialist from short-term training pathway, he sent him jobs, and he was able to find a job. So these are the fellow jobs. They don't count as a training, but they're good to set your foot in the system. None of that experience will ever count towards the specialist comparability application. But again, you'll be getting an experience here. And then I said, use the fellowship job or short-term training jobs as a stepping ground. After about 6 months, you can say, okay, fine, I understand the system. I can apply for a specialist experience pathway or a specialist comparatively pathway. Or if you don't feel that you're confident enough, then you can do AMC and go in through the standard pathway. Finished MD pediatrics and planning to do SR ship, is it preferable to do journal center? Yes, always preferable to do SR ship. DNB anesthesia from India, 3 years of SR ship, planning to write AMC1. Is it better that way? Yes, AMC1 is always good. Trust me, for these comparative specialties, AMC1 will always protect you leaving, because as I said, that after AMC1 you can apply for all the jobs in anesthesia, all the jobs in emergency medicine, which are rampant in large quantity. And once you get the job in these specialties, then the chances of getting a fellowship job. I recently am we are currently helping one anesthesia anesthetist from Pakistan who's done not only AMC1 but also AMC clinical. She was able to find an anesthesia fellow position in a Sydney hospital. So look, AMC goes a long way. Please throw light on some short-term training in psychiatry. I'm not sure about short-term training in psychiatry. You're better off applying directly for jobs, as I said. And once you get a job offer, you can apply for specialist comparability outcome, or you can apply for fellow jobs in psychiatry. And I think there's certain niche areas like child and adolescent psychiatry, addiction psychiatry, forensic psychiatry. Does short-term training experience in Australia count towards the comparability assessment? Not really. This is a gray area. Sometimes you may be able to extract some procedural components. Don't quote me for that. But when it comes to the specialist comparability assessment process, they are comparing your training in your country to that of in Australia. Any training that you've done in Australia is only, here to test the waters. It is not a part of the training program. It is just an experience that you're gaining. So not usually it counts toward it. But then again, if there are certain specific minute lacks, you can say that, look, I have done supervised training in Australia in these areas, and they might be able to get compensated. Steps involved in short-term training pathway, fellowship in psychiatry. As I said, apply for jobs, have a CV, application form, polish them to be looking good. Epic and AMC verification, English tests, apply for jobs, and go for that. Are there IMO registrar jobs in dermatology? Oh, dermatology. Dermatology is one of the most competitive field in Australia. The college in itself, when you're applying for application, one of our participants had unfortunately got an interview date in November 2025 when she lodged the application in October. So almost a year toward an interview, and getting a fellowship position, I think it's just next to impossible. But people have got fellowship position provided how you're presenting yourself. Sorry, my query was that if it's better to do general pediatrics SR ship or in a pediatric subspecialty like pediatric rheumatology. If it's better to do general pediatrics, it depends upon your experience. If you got more general pediatrics, then yes. If not, then pediatric rheumatology. Again, the more subspecific you become, you are talking about limited scope of practice, which means that your limited scope of practice experience needs to be more than 4 years to be considered in that particular area or niche. Otherwise, you won't be either able to apply for general pediatrics or pediatric rheumatology. For specialist assessment, they're necessary to get BLS certificates in Australia. Um, yeah, I don't think so, but normally you would have done it anyway. So that's all about the Zoom questions. Chat box is empty. Thank you. And if anybody's got any audio questions, you may ask that. Unmute yourself. Nobody's got questions. That's good. There's one hand's been raised, Dr. Alina Sun. You can unmute yourself because there are mute. Thank you very much, guys. Thank you.